Good afternoon. I'm going to keep reading through Medical Lit, The Surprising Path Beyond Fatigue, Anxiety, Depression, Reclaiming Authenticity, Vitality, and Freedom. I won't state all the doctors' names. I'm just going to cut to the chase and really speak about some of these issues. Encourage everyone to revisit these ideas. Part one is getting real. Part two is getting well. Part three is getting free. So the introduction says, when I went into the studies of medicine at MIT and Cornell, I did not imagine this again, my summary notes, discussion, comments, not verbatim. Never did I imagine that I had come to shun the primary tool that made my trade, which is the preloaded pharmaceutical concepts where we only treat symptoms and we do not treat at the core what it is that drives many of the conditions that we see are preventable diseases. That's exactly what she did. In 2010, she laid down her prescription pad and she had not started another patient on prescription medication since that point. Instead, she took on the holistic approach to medicine, performance side medicine, encouraging and helping people to overcome any crushing struggles, including generalized anxiety. That means even the fight or flight instincts that can be better controlled, any disorders that are labeled with many, many names. If you actually read some of these texts, you'll understand the list is endless. But listing it doesn't necessarily cure it. It does identify some random tendencies, but the term here means doctor of the soul. And in today's world, millions of people are seeking their own soul to feel more alive, more realistic, and stronger, to feel like themselves. They often land in an office with a doctor who's trained to do one thing or a few things, which is often to identify a type of pill that will, again, minimize some of the symptomatic pains or feelings or responses. However, it does not provide a assessment of what is really going on. And sometimes, many times, it can be misdiagnosed or overprescribed, and that is really why this new model is catching on rapidly. In fact, part of my training in conventional Western medicine was to dismiss and discount anything that's not scientifically measurable, which of course includes the spirit, the soul of the human being. So these are trained doctors devoted their entire life to studying and discussing these matters. People manage to avoid prescription medication. It's likely that they still instead self-medicate with whatever they can find to temporarily ease the burdens, which may be some type of recreational drug, sex, alcohol, food, online shopping. All the while, they may feel worse than ever, trapped outside of their authentic selves. So identifying habits does not condemn them. It means she's not saying do not enjoy life or do these types of behaviors. But when something happens in life, a storm, it's sometimes easier to identify that certain habits may remove a moment of difficulty, but it really doesn't resolve a type of illness or ailment that may be troubling someone. We've been told a story about illness that it is caused by bad luck or by bad genomes, and the best we can hope for is to survive it, mainly by leaning on prescription medications that too often have severe adverse effects or are just plain ineffective. But as new science and real stories of radical health reclamation light up on the internet, which means something that's been taught for a while but not very well articulated, performance side medicine and really homeopathic or holistic or natural medicine, sometimes is spoken about that way, with partnership with doctors who have done decades worth of studies. Today we know that we can adapt and change in real time. It's the beauty of epigenetics and the microbiome, a dynamic ecosystem within our body that presides over our well-being. I know, where she's stating, I know that I can help people reclaim their vitality within the space of a few months, despite a lifetime of living out of alignment. All I do in my clinical practice is to work to restore signals of safety for all patients. I use this phrase often, signals of safety, in reference to many ways that we can tell our nervous system, our heart, our mind, our brain, our spinal cord, even our environment, it's okay, all is well, you can rebalance now. It is possible to do so and quickly because the body longs for it that much. So, in the environment, what I meant by that is simply that there are instances that certain smells or sounds or experiences or days can be a trigger for someone over time, and those aren't necessarily bad things. That just means that the person who experiences life has to be aware of certain days and times and be able to adapt effectively and think about their life in a positive, beautiful manner. This book is a story that points out in-depth coverage of chapters that include how to better deal with fatigue, brain fog, depression, anxiety, even certain types of known non-statistical normal responses. That means some people can get highs that are beyond what are acceptable or safe for them, and some people get lows that are beyond what is safe or acceptable for them and others. And these types of things are telling you to change your life in a way that points towards recovery and recalibration. Illness is health. Illness is health. And it's not saying go out and get ill, but illness is a response to understanding that your body is breaking through some of the difficulties that require a response to choose a healthy habit that helps your body recover. So I've always used the parable of a sneeze. If you sneeze, there can be a million reasons why a person sneezes. They could be allergic to something, it could be dust in the air, they could, have been cooking and some food gotten near their nostril. It could be that they're, ajalukumullah, even cleaning their nostrils. So there's a lot of reasons why a person sneezes, and attributing it all to one reason is as nonsensical as attributing any of the happinesses and stresses of life. And early on, I learned that there is a term called eustress and distress. Eustress is simply when difficulty happens, you channel it in healthy ways like food, exercise, some type of meditation or prayer, some type of friendship or conversation, or any other type of embracing of what is a holistic approach to strengthening. Uh, there are a few lists that I'll speak about at another time, but just for the sake of brevity and uh, processing this information, I'm going to stop there, and I'm going to ask God to accept this simple work and to understand that even reading and discussing these matters is a bigger deal to me and others than you can possibly imagine. So anytime someone feels like their nervous system is responding in a way that's ineffective, just say this: it's okay, all is well, you can rebalance now. أقول قولي هذا، أستغفر لي ولكم ولسائر المسلمين، واستغفروه يا فوز المستغفرين.